Lakeda,
Yeah.
how you doing?
Oh, fine.
Because we don't breathe now since we had that implant. Tell us first of all, what's your experience through that trial? Did you feel like in any way that the procedure was a little bit maybe too painful for you, or?
No, I've had RFA from you, and I've had epidural blocks from you,
Sure.
and so you always try to make sure that your patients are comfortable. You know, as comfortable as possible. So no, and I trust you. You know, I do. I trust you. Yeah. And I think that's what makes the procedure go easier. That's what it did for me, was that, you know, I knew my nurse, I knew you, I met Scott the day of, but you know, but having the people around me that I know, that I mean, I've been seeing you since 2002, and going from a wheelchair to this, and prayerfully back to work, because if this worked if the implant is works as well or better than this, back to work I go.
So any tips here that you want to give people who are going to go through trial, any specific techniques that you've done that makes you relax better maybe, and have that trial really went so easy on you? Is it just because you're too comfortable with you know, Christine, you know, Scott, you know, everybody, that makes you really relax?
First of all, what I would tell people is to get to know their physician that's going to do this procedure. I mean, really get to know your physician and get a good working relationship with your doctor, you know, and then have a point person like, you know, your nurse, who is always, you know, wonderful, and have trust, you know, and I think that's the thing that really did it for me, was I trust you, I know you, you know, and then Scott, you know, he was drumming, and you know, and that was just not funny, and so you know, so it was you know, it was an easy procedure for me. I went home, I slept, I was up the next day, I cooked a huge meal. As a matter of fact, I think I called you and I told you, I cooked greens and chicken and all this stuff, and made homemade apple pies, and you know, and this is something that I have not been able to do without stopping for a long time, and it felt really good.
Overall, you would say, like, you know, how much?
75-80%.
75-80%.
Yes.
Nice.
Yes. 75-80%. Yeah.
So that you will be cruising for the permanent one.
I mean, I don't look for anything that's going to give me 100% pain relief. I mean, other than a miracle. But I mean, but for me, this was actually, you know, in a small way, a miracle, because I was able to do things and not get tired as quick, because people don't realize pain actually makes you tired, you know. And so to be able to go from start to finish, get up, cook breakfast, wash dishes, start dinner, cook dinner, and not stop until, you know, until the dishes were done that night. Hey, I'm thrilled.
180. Totally 180.
Yeah,
Excellent.
I'm thrilled.
That's great.
Absolutely. Absolutely.
Well, I'm sure that thing will be